Senator Deuell.
So you're basically saying that the scriptural obligation to take care of the poor should be done through a government program?
We're saying that the scriptural obligation to care for the poor appears to apply not only to individuals and immediate acts of charity, but to the way that we comport ourselves as an entire society and the way that we interact with each other at a community level.
Don't you think that it's more scriptural, though, to serve those poor people through individuals in the churches as opposed to the government, which then imposes taxes on people to do that?
Well, what I think is that the scripture seems to talk not just to individuals, but to governments. And so it's not either or, it's kind of both and.
Well, when the Bible talks about leaving 10% in the fields, it talked about leaving 10% for the hungry, poor people. It didn't leave 10% in the fields for Caesar to come by, pick it up, and give it to people, or have Caesar obligate people to do that and enforce that. I mean, I'm all with you, but you know, when you're looking at Medicaid expansion and the adverse effects of what that will do to the state and to the nation, which is already broke at $16 trillion, where do we get the money?
Can I just respond real quickly?
Well, sure.
Just to say, I'm sorry. I don't want to. Well, I don't want to take too much. I know you're under time constraints.
I know where your heart is, and I think you know what mine is. But you're quoting Scripture, and there's nothing in Scripture that talks about the government doing what you're talking about. It should come from individuals and the church.
I guess the thing I would just maybe point to is what my colleague down here at the end of the table said. There are lots of ways for the state of Texas to take care of people who need to be taken care of. You can start a whole new thing if you want to. You could start a new program, not just that takes care of 6 million currently uninsured people, but that takes care of 25 million people, some of whom currently have sort of, their point is it has to be a system that actually would work, that would result in those people getting care. And I guess on a practical level, it seems to me that you do have resources available to you. You have programs and policies, and you have dollars, and you have human resources and existing infrastructure. I wonder, the church wants to be the churches who Texas Impact represents, who are our members, I know want very much to be part of a fully functioning system that cares for everyone in the state of Texas and will do everything that they can.
How many of those churches have clinics at their church?
Oh, I think a lot of them. Absolutely. We'd be happy to get that for you.
Yeah, to see how much of their budgets are going toward health care.
We'd be happy to get that.
The Medicaid expansion is not I'm an advocate for the most vulnerable. Okay, I mean, and I think there is a role for government. The Medicaid expansion is for able-bodied adults. And if you want to quote Scripture, St. Paul said, if a man doesn't work, he doesn't eat. Okay, so these are able-bodied adults. And I just don't see where government role, that's where we draw the line. We have to draw at some point you draw the line. Now, the Obamacare, patient protect, whatever, that is designed, the whole thing in reality is designed to get a single-payer government system. It's designed to fail so that the public overwhelmingly wants it. It's interfering with the free enterprise system. It's taking all the things that haven't worked for the last 30 years and combined them into one big bill. They're not doing the tax incentives that we need. They're not recognizing that having insurance doesn't access health care, so forth and so forth. They're burdening the physicians. The reason you have a physician shortage in rural areas is because the Medicaid and Medicare rates are so low that a physician can't go out in rural areas, even make their overhead. And you're advocating to expand a system that doesn't work anyway. And yet I know your heart is very, very good. But I just need a reason why government's supposed to do this, and no one's given me one. And no one advocates for low-income people in health care more than I do. I take care of them. I was director of a federally qualified health clinic. I leave 10% of my office in the fields for low-income people. and all that. And I would dare say, if you look at the statistics, I don't know if it's in this what you gave us, Dr. Malone, but the amount of charity care that the American physicians give people is tremendous. And I'm not talking about bills not collected. But the bottom, we can't afford to give health care to able-bodied adults through government. And I would just challenge you to have your churches start thinking about government clinics or church-based clinics. And it is done in some places, granted that it's done that. And there's all kinds of great organizations. But that's where the answer is, not expanding Medicaid.
Well, we'll look forward to continuing in dialogue with all of you about this over the next several months. Thank you.
We're going to dialogue a lot. Thank you. I love my committee. I just